Okay, good morning, good morning. Actually, it's morning. I don't know when you're watching this. And I just turned the fan off so that my voice is nice and crisp. So this is chapter 12, part 2. And this is our first chapter in Beyond the Basics, Unit 4, in Fundamentals of Therapeutic Massage. So in the first video, we worked on an overview of the chapter, as well as discussing some of the confusion related to the various methods and modalities that show up in scope of massage therapy, but at least parts of them do, but don't necessarily stand alone as a health professions system. So many people will get a massage therapy license in order to give them legal standing to touch, and we have the autonomy to open a practice, and then they will move away from massage therapy as the primary framework and start to use just pieces of these separated out applications. And so we grappled with that, and then we looked at adjuncts, not massage, definitely not massage, but do fit in with most people's scope of practice according to their state license. And with caution and due diligence, can be generally considered safe. With hydrotherapy and thermal therapy, the biggest problem is burning somebody, and then much less, but still possible, frostbite by leaving the cold on too long. And then my biggest concerns of the two methods where I have the biggest concerns are essential oils and instrument-assisted massage therapy. I really encourage people to become more adept at hydrotherapy and figure out ways that you can be inclusive of that hydrotherapy and thermal therapy in the massage therapy practice. So we finished up with KT taping. That's where we're going to start, but we're now switching over to looking at methodology that really is massage. It fits the definition of massage for massage therapists, but it's got an intention or a specific focus. And this focus may or may not stand up to research as far as being evidence-based or evidence-informed. And we discussed that in chapters 5 and 6, proposed mechanisms and research support. So you might want to go back and review that. So let's start with I think I got one of my kitty cats. I think there's a kitty cat hair in here. So let's share the screen and start to look at this, start with fluid movement. Okay, here's our page burst. So now what we're looking to do, the big shift here is we're going to use actual massage methods to specifically attempt to interact with the more isolated idea of a physiological function. I don't know that we can do that. I think that the application of massage, even when it seems to be narrowed and targeted to a physiological interface, I just really don't think it's too general. What we do is just too general, even when we're specific. The mechanisms are just very layered, and it's always going to be a little hard to make claims like this, that massage can target fluid movement, which is lymph, blood, and other potential circulatory fluids. So if we are going to do that, then we have to understand the system in its normal function. And this is where your science studies come in. You need to understand the system, and then you look to see how does it function normally, what can become strained in normal function, and how might we be able to mimic normal function. For instance, a big normal way the fluid is moved is through walking and kneeling down and standing up, where we have joint movement involved. So if somebody is not moving, then possibly we can use some joint movement type pumping methods that would help the body function as normal as it can. So let's get down through our pretty KT taping picture here. And there's been some research, by the way, on KT taping maybe being an aspect of moving or supporting particularly lymphatic fluid. And it's because it has a teeny little bit of a lift and it drags the skin back and forth. So, and that movement is enhanced, that passive movement from the tape is enhanced when people move and walk around. So, okay. So the first one we're going to look at is lymphatic drainage. And this has been separated all the way out to an individual system and has been studied as a precision-based application for lymphedema as part of decongestive therapy. This is usually performed by a physical therapist or a nurse. But others have trained in this, and there is a certification body. So you have to have a license to touch to be able to do this. So if you're not within the medical care arena, such as physical therapist, nursing, occupational therapy, athletic training crosses over a little bit, then many people who want to work with the fluid movement lymphatic system, they will get the massage license in order to let them practice this specialization. The certifying organization is called LANA, L-A-N-A. This is where the confusion around certificate of achievement or completion gets confused with a real certification. So many of the classes that are taken, the providers will tell people they're getting certified, but with the most accurate use of that definition, they're not. Certification is provided by an external body. As I've mentioned before, a simple way to remember that is that the educator cannot provide certification. They can provide certificate of achievement, certificate of completion, but they cannot do the certification. There has to be a organization separated out. So for massage therapy, it's the National Certification Board. LANA, L-A-N-A, is the organization that specifically provides certification for a specialization in lymphatic drainage. So, you know, just to add to the confusion, additionally, there are different schools of thought on this approach. You've got Vader, Foti, I've got them listed here for you. And there's a level of similarity, but there are also differences. So the one that has been around the longest, the one that has, in my opinion, the most research on it, the system comes out of the osteopathic idea. And so that is, in general, the approach that's going to be here in the textbook. And it incorporates levels, all of these different kinds of approaches, but it doesn't isolate just one. Okay, so here is what I did. I looked intensively at the osteopathic lymphatic pump techniques. And I grew up in rural Michigan, and way back when, in the 50s and 60s, the area that I was at, you couldn't get a medical doctor to come out into those areas. And that was when osteopathic physicians were beginning to cross over from primarily using manual methods, form, function, manual methods. Matt got a call. Let me pause. I can figure out how to do that. Yes, dear. Good morning. I am good. What are you doing? Okay, cool. Okay, I think we're back. We are back. Forgot to turn my phone off. So this box then, oh, I was telling you about osteopaths. So I grew up under the care of an osteopath that had been trained in the traditional osteopathic approaches, as well as had crossed over and learned the allopathic medical stuff. So general practitioner, did general surgery, blah, blah, blah. But he also did this stuff. And I remember when I had pneumonia, these pump techniques was one of the things that this physician did. So you can get on YouTube and search for osteopathic manipulative technique and or lymphatic pump techniques, osteopathic, and you can catch into some videos that are up there for osteopathic medicine students. And then when you look at stuff that is for another occupation, what you have to do is screen through and say, okay, how is this part of my scope of practice, and what can I use? What can I pick up and use? And compare it to, okay, this is massage. This is what typically massage looks like. And one of the tenets on that is, are we working with a generally well client, a generally healthy client, and we're trying to support normal function primarily? Or like when I had pneumonia, are we dealing with a significant health issue that needs to be monitored by somebody who has additional training? So when you look at the procedure that is in the book here, and then Luke and I will be doing demonstrations in class and also some demonstration videos to reinforce, it's the application is based on methods you already know. It's based on joint movement and drag and moving, adjusting your pressure so that you're primarily sliding the surface tissue, the skin and superficial fascia, and the rhythmic nature of it. That's, you know, we're thinking of water, and with water, you think to move it, you think of a pump, or you think of a pressure gradient, or you think things like water runs downhill. So when we're thinking about moving lymphatic fluid, I often will use the idea of a squeegee, how you would squeeze, you know, if you're mopping the floor, or if you have had a excessive water spill and you're trying to move it towards a drain, how would you do that? And the applications for lymphatic drain and blood, for that matter, is pretty simple. The difference with lymphatic work is that we are really working to accomplish two things: to support movement of the interstitial fluid, the tissue fluid, the fluid around every cell, into the lymph collectors. And then once it gets into the lymph collectors, there are a couple, three pumping mechanisms that supports the movement of the fluid through those tubes. So it's a combination of how do we squeegee the fluid into the tubes, and then how do we support movement of the fluid through the tubes. And with the blood circulation, with the arterial flow, the oxygenated blood, we're moving fluid out towards the periphery. But there's an actual pump, the heart, and the arteries themselves have a pumping mechanism with them. And then when it moves back up through the veins back to be reoxygenated, there's still not as significant, but the blood is still in the tube. So when we're thinking of blood circulation, we're thinking of moving fluid in a tube. It's at the capillary level that the tissue fluid seeps out. And then we need to think more about a squeegee. So anyway, those are the ways you start to think about the application. So we talked about, if we're going to do this, then we have to mimic normal. And so we have to know what normal is. So if you go to your essential sciences, there will be information specifically related to the lymphatic system. And you may want to even explore beyond that, especially if you have an interest in this. And so we have to kind of know where the tubes are, and we have to understand the nodal filtering system and appreciate that they're located where there's a lot of movement in the body anyway. So every time we move, we're moving, we're pumping against these lymph nodes. And then once we get into the fluid gets into the thorax here, the breathing and the peristalsis, there's a lot of movement within the visceral cavities here, and in the thoracic cavity. And the nodal areas are filtering stations, and there's immune system function that operates in there. And then we have lymphoidal tissue as well, like your tonsils and so forth. So as far as studying for the MBLEX exam, you're going to want to have a pretty good idea of where these various vessels are and the nodal points are. And they're primarily, again, like I said, located in the jointed areas and in the thorax. So here are some indications about when either we can feel comfortable working or that we might want to refer. So there are serious health conditions that have edema, which is an increase in tissue fluid, as part of their symptomology. And so we just can't assume that it's fairly benign and more of a functional issue. Congestive heart failure, for example, is often a symptom of that is swelling in the legs, especially the lower leg. So there's also a difference between tissue fluid accumulation, which is edema, and then mostly in the veins, but if the pumping structures that support the movement of blood through the tubes there, if they're not working very well, you can have it presents similarly as edema, but it's really congestion, and congestion is more in the tubes, and then it's common to have both occurring at the same time. So because swelling, even if you don't know exactly which one it is, can be a symptom of a serious condition. And it's persistent, and there's no logical cause for it. This is an indication for a referral to figure out what's going on with that. Now, an increase in capillary permeability so that more fluid gets out from the more tissue fluid then is able to, fluid from the capillaries is able to move into the tissue spaces. Part of inflammation is part of that, which is part of the immune system response. So, and there are various chemicals that support that dilation, that capillary dilation. So we also have to stop and go, is there an inflammatory process? And we also have to stop and consider that medication can be part of an accumulation of tissue fluid. So here's when massage is indicated, and here's where you need to be careful. So here are the principles of lymphatic drainage, massage. And we are not claiming that we have precise specialization, education in dealing with lymphedema. We're looking at simple tissue fluid movement. So you need to be a little cautious, especially because there is for real certification for lymphatic drainage, you need to not say that you are a lymphatic drain therapist. You certainly can say that massage applications can be modified to work with and manage simple edema or support fluid movement in general. So here is, we're going to start looking at how do we do that? How do we go from our general massage that we learned in chapter 10 and pick and choose certain approaches and certain modifiers in order to more specifically target the lymphatic movement and then circulatory system on top of that. Now this box right here gets into a dicey area. Stagnant lymph, stagnant tissue fluid can become dirty because there's a lot of cellular byproducts and waste there. But what people want to say is that this particular approach or massage in general removes toxins from the body, and that's not true. So this box, it's actually from an article I did for Massage Magazine, it's important for you to slow down and read this. So part of the confusion is that we don't define a toxin well. We think our body is dirty and all that. The truth is we have good systems within our body to be able to manage the normal byproduct load of metabolism. Where it can get a little dicey is environmental type toxins that our physiology is not necessarily designed to deal with. And there can be exposure to environmental type poisons, heavy metals, that sort of thing. And that may need to be treated by a physician to try to help the body eliminate those real toxins. But massage is not it. So we have to make sure that we are able to educate clients, because this idea that massage moves toxin or moves lactic acid, it's persistent. And even if when massage therapists are getting the idea, clients still hold on to that idea. Okay, so pressure, speed, frequency, these are all modifiers. If we go back to, there's 4 basic outcomes and 4 approaches to care, and then there are 9 methods and 12 modifiers. We're going to have 1 or 2 methods, and then we're going to modify those specifically to mimic normal in the lymphatic system and the circulatory system as well. So the biggie here is drag. We want to actually slide the superficial tissue, the skin's superficial fascia. We want to slide that back and forth and not slip. And that's going to mimic the pumping action of how our tissues slide on each other when we're normally moving around. And there's a lot of collectors in there. So, and we don't, and when we're trying to get the superficial fascia to slide, we don't want to press too deep, because that in and of itself is going to interfere with this back and forth, which becomes a pump, this back and forth sliding mechanism. And then joint movement is a big deal with this, passive and active. So here is your specific sequence. And I'm gonna move forward here for a little bit because I want to show you something. So at the end, we're going to talk about blood circulation, but at the end of this, we actually have combined focuses for supporting lymphatic and blood movement. And these pictures here are helpful in showing you main directions and locations. And then there is a fluid movement protocol that combines the focuses. And if you just follow that down and get used to that, and realize that this can just be embedded, these ideas can just be embedded into the general massage, which is gonna maybe have some benefit, and it's likely not gonna hurt. So this focus is demonstrating on the lower limb, but you can do the same thing on the upper limb and to a lesser extent in the torso. I mean, it just doesn't lend itself as easy to that. There are specific pumping applications for the torso. So then this fluid movement protocol moves to the blood circulation, and then arterial, and then back with venous. And you just keep repeating this cycle over and over and over. And it just becomes a variation of part of what you're doing with the general massage. So let's go back up. So I have an element of fluid support in every massage that I do. And the assessment for an indication for using a more precise movement is primarily based on palpation and observation. So you can see when there starts to be a water balloon look to a limb, or if a person is generally kind of sluggish and there's a reason for it, premenstrual, for example, then you can just maybe incorporate this a little more. This is the methodology I use to work with athletes with delayed onset muscle soreness, because it seems to be an inflammatory fluid issue. And so if I were working with an athlete with delayed onset muscle soreness, or anybody with delayed onset muscle soreness, I would certainly use this flow as part of the general massage. Okay, so we've already started to talk about the, something happened here, the circulatory system. Let's get back up here. So this is where you really want to pay attention to your science studies and the pathology in the science book. Let's see if we can actually get to that. Okay, here we go. Adaptive massage targeting blood circulation. So the difference here is that with the tissue fluid being everywhere and the pumping mechanism being involved with movement, you can see where increasing that focus can move the lymphatics. It's actually the interstitial fluid. And then it's lymph once it gets into those vessels. But blood is in tubes. So, and it has its own pumping mechanism with it. And I think that you automatically get this when you do a general massage. But should you want to be more focused, then we have to know where those tubes are, and we have to understand the dynamics of water, fluid, under pressure. So I oftentimes will use the example of a garden hose. So if we turn on the faucet, water starts to flow through the garden hose. And if we crimp the hose, looking for an example here, which I don't. If we crimp the hose, that's going to restrict flow. And so the pressure above the crimp between the faucet and where it's crimped, that will build, that pressure will build. And then if we stop crimping, straighten it back out, then you'll have a little bit of a pressure head that will push that fluid through. So if you think about where the main arteries are and the main veins, they're located in between functional muscle groups and a little bit more to the inside. Now you can actually see the vein tubes on top of your hands, but typically not an artery. Arteries are pretty deep and they're pretty protected. And then the arteries get smaller and smaller and smaller and smaller until they get one cell thick and become a capillary. And the capillaries are everywhere, more so in what's tissue that has a lot of blood, like muscle, and not as much in tissue that is not got a lot of blood access to it, like cartilage, but there's still some there. When it gets down there to the capillaries that are like just a continual web throughout, then potentially we can encourage capillary exchange with some kneading, squeeze a sponge or some compression, which is what we do with massage anyway. And then we can support potentially the return through the venous system back to the heart to be reoxygenated. And instead of a pump there, it diminishes. There are some intrinsic pumping actions, but it does diminish as it's trying to go back up. Now we're back to compression of the muscles against the tubes. And so a short gliding action over the tube, think of trying to move water in a straw, may support that. You do not want to strip dig in these groove areas where these vessels lay, because the nerves are in there too. And so there is a valve system with the veins that potentially could become compromised probably not from massage, but if they have already had some failure at the valves to prevent backflow, or they are not protected really well because veins are closer to the surface, then I mean, it just logically we wouldn't want to aggressively work over those tubes, just like we don't want to squeeze a nerve because it's like a worm. We wouldn't want to do that. So broad-based compression and broad-based gliding is much safer and will get the job done than being very precise. So you have to pay attention to the anatomy. Now, for both the lymphatic system and the circulatory system, there are places where there is a lot of these various vessels, and they're congregated there because there's typically a lot of pumping, compression, let go, and or movement. So the bottoms of the feet and the calf muscles, especially for venous return, so those need to be targeted with more of a rhythmic pumping kind of a action. About the rate of the heart rate, you know, so you can take a pulse and then you can go, okay, 60 beats per minute, that's 1 per second, you know, 1 and 2, and you know, so that you're working with what natural pumping mechanisms are involved. And this is water. You cannot push a river. You gotta be patient with this. So you want to pay attention to the anatomy and physiology, and then you want to say, okay, now I understand how this blood or this fluid moves, and I know the structures that it is moving in, and so here's how I would adapt the massage to more specifically attempt to influence this normal physiological function. So, like I said, I have pulled this together for you into a fluid movement approach. You don't have to use this, but it's a good way to just generally incorporate the support for the lymphatic system and the circulatory system. It blends in with the general protocol very well. In fact, when you're watching the general protocol and you're listening to it, you start to get, you'll hear me say, okay, so now I'm working more with a lymphatic focus, and now I'm trying to focus on the circulatory system, and our next one I think is connective tissue. So you'll see how that is just woven in. It's one of the reasons why joint movement and being able to specifically move all of these joints, active and passively, is so important. If you just incorporate that into the massage, you're going to support the fluid movement. And there's some positioning things. I mean, water runs best downhill. So we try to get the body positioned so that it's on a slope toward the heart. And then interestingly, all of the pumping the movement at the ribs and the pumping action on the abdominal area and the back, to, try to work that bellows back and forth and support that movement on the torso is pretty much how we work to support breathing. And breathing is integral part of moving fluid once it gets into the torso. So this is another overlap that happens here. So that is going to finish up the fluid movement segment. And again, as a reminder, we're looking to incorporate these principles in the general massage. And if somebody has some simple tissue edema, or they have some sluggish circulation, then maybe we can become a little bit more precise, either locally or systemically within the whole massage with this. I have to tell you, and I refer you back to chapters 5 and 6, the research evidence for this is poor. So we're on biological plausibility here, as opposed to evidence-based, certainly not. Maybe some evidence-informed. And this has been difficult for the massage community because for years and years and years in the past, there was an assumption that massage moved fluid, and that was a big mechanism of benefit. And it does squish this stuff around. It can't not squish it around. So there is an effect at a local level, and there can be a chemical effect too. When we massage the soft tissue, histamine, as an example, is a vasodilator. That's going to open up the blood vessels. You're going to get an exchange there. Information changes, and we have to be willing to change with it. So this is a biologically plausible way to approach a fluid movement focus. Okay. And the next one is on connective tissue, and that's got its own conundrum to it.